Hello everyone, so welcome to Mommy Aren. I'm Pauline and it's nice to have you here. So today I want to talk about eczema, that is atopic dermatitis. And the reason as to why I've chosen this topic is because personally, as a mommy, I have a child, a baby, who is having this condition. And I visited a dermatologist just the other day, and I would like to talk to every mommy out there whose child is having this condition, to encourage them. It's manageable. It's very manageable even at home. And now I want to talk about it, to enlighten you about it, to know what it is, how it comes about, and how to manage it. Okay. Yeah. When you talk about atopic dermatitis, we are talking about a chronic skin condition. Okay. Usually have acute and chronic. We talk about acute. Acute is something that just happens it's not long term. But when you talk about chronic, chronic is something that it's there, and you have to put measures to avoid it from coming about. So it's also called eczema, atopic dermatitis. It is a chronic inflammatory disease of the skin. Makes the skin dry, itchy, the baby becomes itchy, and sometimes it might seem reddish and have some patches. That is an inflamed skin. So that is some of the common, how its common presentation. It's usually common in infants and children, but it can also affect adults if they are exposed to the triggers that can cause it in their body. Okay. So when you talk about it being chronic, it keeps relapsing. So let's say the baby gets treated, but then they get exposed to something that triggers the immune system on the skin to react. So it can relapse, you treat again, then after a few years or months it relapses. So you have to keep avoiding the things that induce this reaction. Okay. Another thing you have to note, it's chronic, and it can relapse. The second thing, it is non-contagious. Okay, you cannot catch it from someone else, and also your baby cannot catch it by maybe playing with another child who is having atopic dermatitis. So it's not contagious, and it's often linked to allergies. Okay, it's linked to allergies. Many people who have atopic dermatitis, some may have asthma, God forbid, for our babies. Yeah, some food allergies, hay fever. So when this is, you have to note if your baby is having atopic dermatitis, especially when you want to start weaning the baby. You have to be very keen and very observant, so that you see if maybe if she's reacting to some foods, especially when you're giving the proteins. You have to be very observant, so that you note early, maybe if your baby reacts to this food or this protein and does not react to the other. Okay, so that you don't keep exposing them to something that triggers this immune reaction. Okay, so let's talk about the causes. What causes atopic dermatitis? First, can be genetic. Okay, and mostly it's genetic. Maybe you have parents or siblings who have history of eczema, asthma, allergic rhinitis. All these are different presentations of atopic dermatitis. Another thing, it could be, okay, these causes can come as a standalone or can be a combination of different 1, 2, 1, 2. Okay, Another cause could be immune system overreaction. Your baby is reacting to a trigger. Okay? And then defective skin barrier. Maybe your baby was crushed by something, and then they react, making the skin dry, allowing allergens to enter that place, and then your baby becomes irritated by it. Another cause could be environmental trigger, which is it's the highest cause of this, if I may be asked. When you talk about environmental triggers, we're talking about soaps, dust, sweat, perfumes, okay, cold weather, certain fabrics, stress. So there are so many things that cause atopic dermatitis. So symptoms of atopic dermatitis, we have itchiness. You'll see your baby keeps putting their okay, especially for my baby, she usually keeps putting her hands on her face and doing like this, scratching. She doesn't know what she's doing, but she's actually scratching her skin because it's very itchy. It was very itchy before I took her to the dermatologist, before we got the medications. Another symptom could be dry, cracked skin. It could also be scaly, 6 scales, okay, and the skin is dry and cracked. Then another one, you red patches and dark patches on the skin. Then after long scratching, the baby can form thickened skin, like the skin feels thick than it was. Let's look at the common sites where atopic dermatitis is usually seen, especially in babies. It's on the cheeks, okay, on the scalp, arms and legs. Okay, so on the cheeks, scalp, arms and legs. Kidogo baby. Then another place, especially on the cheeks, like for instance, I'll keep using an example of my baby. She started having here, you see here, it started being like, what should I say, let's say the skin is darker, the normal skin is darker, and then when we look at here, the skin is less dark than the other place. It looks like it has a skin, another color of its own here. Then on the eyes, okay, patches, and then the hair starts falling off. Okay, I saw the hair starting to fall off, like literally. I even thought, like, you could even think that the baby has been shaved with a shaver. Okay, so those are the main sites for atopic dermatitis in babies. And then we also have sites for children and adults. We have for children, mostly it's the elbows, behind knees, neck, wrists, and ankles. Okay, yeah. So treatment. How do we manage atopic dermatitis in babies? How do we manage atopic dermatitis in babies? One, we have to do daily skincare. Daily skincare using gentle, fragrance-free moisturizers. Okay. For instance, we have the petroleum jelly, the blue one, the blue petroleum jelly. That is the original one. We also have, for instance, for my baby, I was prescribed for this. I don't know if it's yeah, this one, Epimol cream. and all other fragrance-free moisturizers. You should take lukewarm baths and then apply the moisturizers immediately to seal the pores from so that fluid does not escape through the pores. Okay. Yeah. And then avoid harsh soaps. Make sure you use mild cleansers. For instance, the Dove sensitive skin. That is the blue one, the original Dove. Okay. I wish I had the box. But for my baby, we are using Epimol. I hope it's visible. Is it visible? Yeah, Epimol soap. The reason as to why the doctor didn't write for me Dove, it's because I was using Dove. I've been using Dove to wash her since she was born. And then the skin still reacted, so she changed my washing soap to Epimol. And then we have medications that are used to treat atopic dermatitis, especially the topical corticosteroids. Okay. You use things like betamethasone, hydrocortisone. Then the doctor might prescribe hydrocortisone to apply on the baby's face and their scalp. Okay, you'll be taught on how to apply. And then we have other things like topical calcineurin inhibitors, for example, tacrolimus. I have used tacrolimus personally for my first baby. For this young one, the doctor didn't prescribe it, so I didn't buy it. So I'm hoping they'll prescribe, they'll do away with the corticosteroids once I go again to visit her, and maybe prescribe something that is less steroidic. And then we have other things like antihistamines for itching. Okay, they help to prevent the itching, especially at night. Sometimes if the baby has scratched somewhere and then it got infected, the doctor might prescribe antibiotics for the baby. So for medication for eczema, topical corticosteroids, the steroids help to prevent, to reduce the inflammation. Then you have tacrolimus, these calcineurin inhibitors. I hope you get. One is like tacrolimus. It's, for me, I'd say it's the best to use on the face because it is let me say, it's best to use on the sensitive areas like the face. That's what I used for my baby. My big baby is around 3 years old. The eyelids and the lower lid had hypopigmented and they were looking so scary. So I took him to the dermatologist and they prescribed this. Then you have to change, to do some lifestyle adjustments when you're dealing with an eczema. When you're dealing with a baby who is having eczema, first, avoid triggers. Okay, avoid perfumed soaps, some wool clothes. I was told to use 100% cotton clothes mostly, especially the clothes that have direct contact with the skin should be cotton, 100% cotton. And then avoid heat, so don't overdress the baby, and stress. Keep your baby nails short, because if they're itchy, they're going to scratch, and they're going to, sometimes they scratch and hurt themselves. You can use air humidifier if your home area, the air is very dry. But for me, I don't use that. I don't even have one. Maybe I'll get one someday. Alright, so, and manage stress. Babies can get stressed up maybe when you leave them unattended. Yeah, maybe they you leave them cry a lot. So manage stress, because stress worsens flares. So see a doctor if the skin of your baby is losing pus, painful, or it's crusted. This means that maybe the baby's skin is infected, and that means they need to be prescribed for antibiotics. Okay. Also, go to the doctor if itching and rough and interferes. If itching interferes with sleep and daily life, if itching interferes with baby's sleep and daily life, please see a doctor. And if home care isn't helping, you see a doctor. But as for me, Pauline, and I'd advise you as a mommy and also as a nurse. If you see my channel is Mommy RN. RN means a registered nurse. I would advise you, please, if you see there's something wrong with your baby's skin, just rush and go see a doctor. Don't go to the pharmacy. Don't do over-the-counter medications, please. For your baby, go see someone who has studied for that condition and they manage it. Okay. So thank you for watching till the end. I had to do this video. I had to do it because I keep telling myself I'll do it, and then I don't get time to do it. So thank you for watching. Please subscribe and help me grow my channel so that I help mummies know more about conditions that affect babies in a layman's language. Okay. Thank you. Bye bye.